Welcome to RN Mindset Prep. Today we're going to look at one of the most dangerous traps on the NCLEX, giving oxygen to a COPD patient. Here is why this matters. Most patients breathe faster when carbon dioxide rises. COPD patients can lose that response over time. Instead, they breathe because their oxygen is low. That is called the hypoxic drive. Give too much oxygen, and you remove the only signal telling their body to breathe. That is when things go wrong fast. Scenario 1. A 62-year-old patient with COPD is mildly short of breath. Oxygen saturation reads 88%. The new nurse decides to act fast. What should the nurse do first? Option A. Apply a non-rebreather mask at 15 liters per minute. Option B. Raise the head of the bed and reassess within 5 minutes. Option C. Apply oxygen via nasal cannula at 2 liters per minute and monitor closely. Option D. Encourage the patient to take slow, deep breaths and withhold oxygen entirely. Let's break this down. Option A is incorrect and potentially harmful. A non-rebreather mask at 15 liters per minute delivers near 100% oxygen. In a COPD patient, this level of oxygen can suppress the hypoxic drive and cause the patient to stop breathing. This is exactly the scenario that ends badly. Option B is incorrect as the only action. Positioning helps, but an oxygen saturation of 88% still needs a targeted response. Reassessing without treating is not safe here. Option D is also incorrect. Withholding all oxygen when saturation is at 88% is dangerous. The goal is controlled oxygen delivery, not zero oxygen. The correct answer is option C. Apply oxygen via nasal cannula at 2 liters per minute and monitor closely. For COPD patients, the target oxygen saturation is 88 to 92%. Low-flow oxygen corrects hypoxemia without removing the hypoxic drive. The nurse delivers just enough oxygen to keep the patient safe, then watches for any change in breathing rate or level of consciousness. This is the NCLEX distinction. The intervention is not whether to give oxygen, it is how much. Scenario 2. A nurse receives a patient with known COPD transferred from the emergency department. The transfer paperwork shows oxygen was started at 10 liters per minute via simple face mask 1 hour ago. The patient is now drowsy and breathing only 8 times per minute. What is the nurse's priority action? Option A. Increase oxygen to maintain saturation above 95%. Option B. Call the provider and prepare for possible ventilatory support while reducing oxygen flow. Option C. Remove the oxygen completely and stimulate the patient to wake up. Option D. Reposition the patient and continue monitoring for 30 minutes. Let's work through this. Option A is incorrect. Increasing oxygen in this situation would make the problem worse. The drowsiness and slow breathing are signs of carbon dioxide retention caused by too much oxygen suppressing the drive to breathe. Option C is incorrect. Removing oxygen entirely puts the patient at risk for severe hypoxemia. You do not swing from one extreme to the other. Option D is incorrect. A respiratory rate of 8 with a drowsy mental status is a clinical emergency. Waiting 30 minutes is not an option. The correct answer is option B. Call the provider and prepare for possible ventilatory support while reducing oxygen flow. The patient is showing signs of hypercapnic respiratory failure. The nurse must act now. Reduce the oxygen to a controlled low-flow rate. Notify the provider immediately and be ready to support ventilation. This is a situation where bag valve mask equipment and a rapid response team may be needed. The NCLEX key takeaway here is this. For COPD, always think controlled oxygenation. The target is 88 to 92% saturation, not higher. When a COPD patient becomes suddenly drowsy or their breathing slows after oxygen is started, think carbon dioxide retention and act fast. What feels helpful can cause harm if you do not know the physiology behind it. See you next time on RN Mindset Prep.